Hello, I'm Steve with Fitness for Five and the co-founder of Fitness for 10 here with Dr. Nario, Biointegrative Health Center. Biointegrative Health Center is located in Reno, Nevada, and we're always happy to have you here. The interviews have been great, so welcome, Doctor.
Thanks, Steve, for the invite.
Okay, so I want to start a two-part series on vitamin D. So we'll call this our first part. In this interview will be the first part. So what is vitamin D?
All right, so vitamin D now comes into the conversation because it's winter time. Winter time, there's no sun, and sun is the most common thing that's affiliated with vitamin D. And what are we missing without sun? Well, number one, we don't have a good tan from the sun. Number two, we're not getting the rise of endorphins, the feel-good hormones that makes us happy. And the most important thing, lastly, is the freebie vitamin D is not available for us for the reason that sun is the one that activates it on our skin. And the thing here is when activation happens with sunlight and the available vitamin D on our skin, the creation of the wonder drug happens. And it's one of the most inexpensive among all the vitamins, and as well, the innumerable beneficial effects made by vitamin D, a big candidate or a favorite for our supplements that we take every day in our little tray. And the most famous claim to fame now is because of COVID. There are actually almost 30 or more studies out there that shows that if we maintain an optimal or a good vitamin D level, it reduces the risk of COVID-19 producing, yes, the actual full-blown infection, the risk of severe complications, and even, of course, dying. You don't want to be on that boat. And the research is currently overwhelming, and the evidence is there.
Wow. Okay, so yeah, I take vitamin D. Now, tell me a little more about vitamin D. Is vitamin D really a vitamin?
Good question, Steve. No, that's one of the bigger misconceptions about vitamin D. The common misconception is it a vitamin or is it a hormone? A vitamin, why? Because you would hear about vitamin D in the conversation of being fat soluble. And as a hormone, it can act, it's actually generated by our own body. As I told you, it's actually produced by naturally from our skin. And this is skin cholesterol. As the sun hits our skin, it then gets activated to vitamin D. And that makes it a hormone. And that's why I really don't want to dissuade either one. But basically, it's really more of a hormone. And if taken as a supplement, and then it's called a vitamin because it's an external source that you put in your own system.
Okay. So are there different types of this vitamin or hormone or whatever you want to call it? What are the different types?
Now you're confused too.
Yeah.
Well, the thing here is there are two types of vitamin D. One, you hearing about D2 and D3. Well, D2 is actually comes from yeast sources. And this is more famous when your doctor writes a prescription for you. And here, this is for your vitamin D deficiency. D3 comes from plants and animals such as sheep's wool. And this supplement is commonly seen combined with vitamin K2. And this is the one that actually utilizing the synergistic effects of both vitamins being together in one supplement to bring out benefits. An example, there's so many, a common example would be bone health. When you use the combination of both, it enhances bone growth compared to just taking vitamin D3 alone.
Okay. So what can cause us, I mean, you talked about being in winter and less sunlight. What causes vitamin D deficiency?
Another good question, Steve. So the studies actually had shown 42% of the US population is vitamin D deficient. And if you're thinking, wow, that is huge, it is. It's almost reaching 50%. Being in North America, that's already a huge risk factor for the reason that majority of the states are on a higher latitude, meaning, of course, it's harder for the sun to get in there. and winter months comes in. And also you have to think about the sun rays that lands on an angle that's when you talk about you stand outside during the midday for at least 15 to 30 minutes just to get enough vitamin D from the sunlight. It's not happening just because of the angles are not right for you to get ample amounts for this activation. Thus, the reason for supplementation. Another reason would be staying more indoors. Now you know about COVID, and it's saying that, yeah, you have to stay indoors more now. And also isolation, 6 feet distancing, yeah, it comes in that you have to stay at home. And you also have to think about the indoor jobs that are, everybody's working from home, there's no sun, wearing clothes, especially during the winter time. When you have long sleeves, of course, sun is not getting through that. Sunscreen use, another big reason why vitamin D is so low. Living in smoggy areas because the clouds are covering the sunlight. And also being in an inflammatory state, meaning you have arthritis, overweight, obesity, and if you think about it, we call it the fat-soluble vitamin. It stays in the fat. And imagine if somebody loses weight, you're going to release all those vitamin D back into your system. And another one would be as we age, there's lower capacity for the system to create our own vitamin Ds. And another minor one would be supplements that are poorly regulated, meaning they don't have that claimed amount of vitamin D that they have inside. And of course, people take it knowing that it's probably there, but it's really not.
Okay, so is there a way for us to know if maybe our vitamin D is low, or is there symptoms? Is there a way for us to know what would indicate that?
Well, common symptoms, it's a very generalized type of umbrella if you think about it. But vitamin D is really known for calcium, calcium absorption. And it's also related to bone health. Of course, fracture risks and also bone injuries are one of the clues that you probably should check your vitamin D levels. But other symptoms would be, yes, getting sick a lot because the immune system needs vitamin D, low energy, back or muscle aches, even joints, depression that comes along with, of course, you not getting sunlight, and that happens a lot with wintertime, and sometimes impaired healing when you have an injury, and also sometimes hair loss and even bone loss in relation to what we call osteoporosis.
Wow. Well, it sounds like it's a very important substance to our body. So I really look forward to our part 2 next week on vitamin D. So
Well, there's something that I really want to emphasize before that concept that I laid out right there. Is that deficiency is present in so many forms. Any symptom could be related to vitamin D. But the problem here is, I mean, the actual reality of this is you just need to diagnose low vitamin D, and once you start treating it, the patient will experience a dramatic improvement once the actual diagnosis has been made. And it's only a simple blood test, really, that would take it, and your problems might be solved just because of that.
well, okay, that answers another question I had about how do you know, blood test. Okay, well, Dr. Nario, Biointegrative Health Center, thank you very much. They're in Reno, Nevada. You can look them up online, and we will see you next time.
Thanks, Steve.